So you're taking care of a patient that came out of the cath lab a few hours ago. They had a diagnostic cardiac catheterization, so there was no intervention performed, and they had a little bleed in the cath lab but were stabilized before they came to the unit. However, the patient calls, rings the bell, says, I don't know, I think I feel something funny at where they did that procedure. So you go in and you're going to expose the patient and you will palpate the area, and perhaps you recognize that the patient does have some rebleeding. So we're going to first of all apply direct pressure, what we just went over with on the slides, apply direct pressure, and if it can ideally be maintained, we would like to do that first. What we can do afterward is apply a band around the waist where we apply pressure and maintain it. So this is one type of manufacturer's band that I've applied here. And what you can see is it's a clear device, and over the top is a clear window where you can see the puncture site. This should be placed so that the puncture site is about 1 to 2 centimeters below the center of the device here, and you can see it. One of the things I want to point out about this is that if you do need to apply this, and this will be demonstrated at the seminar, it's great to have written on by the nurse, not the manufacturer, what time you applied the device, when you released it, and when you removed it. So that's a great way that you can follow your hospital protocol. So depending, again, whatever your facility protocol is, you apply the device for the femoral catheterization site, and then you're going to dial up to increase the pressure, because what you want to do is apply pressure directly onto that site and then lock it. And then you maintain the pressure at a predetermined time according to your hospital policies, and when it's on, you will dial down to release some of the pressure. Okay, you're checking pulses this whole time on the patient, always assessing the patient and making sure we don't have a rebleed. And it's great because you can see through this device to see if bleeding has occurred. If, again, you had any rebleeding, follow your hospital policy. You would increase the pressure again to maintain it, and then dial down again with whatever your policies are. Hopefully we can maintain this from further bleeding, and the patient will remain stable throughout.